歡迎各位出席今日。
Welcome to today's press briefing on infection strategy and COVID-19 pandemic. Today we have Secretary for Health Professor Sophia Chan, Secretary for Home Affairs Mr. Casper Choi, Director of Health Dr. Constance C. Chan, CEO of Hospital Authority Dr. Tony Ko, Dr. Chang Chok Kwan, and Dr. Lau Ka Hin from Hospital Authority. Professor Chan, followed by Secretary Choi, will speak first, followed by Dr. Trang and Dr. Lau on the latest case situation and the Hospital Authority situation. Secretary, good afternoon, friends of the media and members of the public. Good afternoon. Today I would like to discuss the latest pandemic development as well as the various arrangements on social distancing measures after the Chinese New Year. Today, the Secretary of Home Affairs is with me, and also I would like to review the testing operations over the past few weeks. In terms of the pandemic action, over the past month, our epidemic strategy is to be ahead of the pandemic. Through intensive large-scale compulsory testing, we hope to intercept early of any hidden transmission chains. The numbers have informed us that this strategy is a success. Our confirmed cases on a 7-day average since early January has been rising until the peak on 24th of January reached 75. The untraceable local cases at the 7-day average was at 30 cases daily. Since in the middle of January, we stepped up our compulsory testing endeavors. Case numbers has been declining. In the past 7 days, the local confirmed cases daily is around 26 on average. Compared to the peak on January 24th, has dropped over 60%. Untraceable local cases is around 7 per day. Compared to the 24th of January peak, it has dropped over 75%. In just 2 weeks through intensive large-scale compulsory testing, we gradually put the pandemic under control. I would like to first thank the public cooperation, the patience and understanding of the affected sectors, as well as the endeavor of the anti-epidemic team of working around the clock. That is the success shared by everyone. On reviewing on the compulsory testing, I would like to take this opportunity to review the large-scale compulsory testing exercise over the past month. From late last year, we have gradually lowered the threshold for compulsory testing on residential buildings, and in mid-January, we targeted Jordan, Yau Ma Tei, Mong Kok, Hong Ham, and Sam Shui Po, certain high-risk areas, in delineating or designating specified areas to further step up compulsory testing. From the start of this year till now, we have issued compulsory testing notice to over 380 residential buildings and successfully identified quite a few asymptomatic cases and managed to swiftly intercept community transmission at its source. The effectiveness of compulsory testing hinges on 2 factors: quick and thorough. In order to perform a thorough screening in the affected areas within the shortest possible time to identify infected cases, from 23rd of January, besides issuing compulsory testing notice, the government have also issued a total of 26 compulsory testing restriction and testing declarations involving over 200 buildings in what you public call lockdown. Around 25,000 members of the public in risky area were tested, which we managed to detect 20 confirmed cases and around 60 close contacts. The positive percentage is around 0.1%. Later on, the Secretary for Home Affairs will share more details on the operations with you. I also would like to thank the public cooperation and also of the colleagues for the auxiliary medical service, as well as the support of the testing contractors, so that each restriction and testing declaration operations can be complete within the shortest possible time. While fighting the epidemic, we managed to minimize the inconvenience of the public, barring any sudden changes to the pandemic. And just like the chief executive has said yesterday, hope that from today on until the end of the Chinese New Year, there will not be any need to issue a restriction declaration notice. However, our work will not stop, and will continue to issue compulsory testing notice for buildings with confirmed cases. Also appeal to the relevant residents to comply with the notice requirements and get tested. The government will stringently enforce the law, including performing surprise inspections. We find anyone failed to comply with the testing notices, we will immediately issue a $5,000 fixed penalty tickets. We have so far issued 63 fixed penalty tickets. We hope that the public can cooperate and exercise self-discipline. And now I will talk about relaxing the restrictions on catering business and scheduled premises. Overall, we are cautiously optimistic on the pandemic. If everyone in Hong Kong that during the Chinese New Year can stringently maintain social distancing and personal hygiene, and based on the current trend after the Chinese New Year, we hope that we can gradually get back on our feet. Over the past few weeks, the government have been communicating closely with the scheduled premises and the catering sector. We are well aware that they are proactively hopeful to cooperate in strengthening the anti-epidemic measures, in hoping to resume evening trade and also reopening their businesses. We hope that on the 18th of February, the 7th day of Chinese New Year, we can relax with conditions on the prevention of control of disease requirements and directions, business and premises regulation 599F, on the restrictions on the catering business and scheduled premises, which include the following. First, allowing some of the scheduled premises to reopen at limited extent, which include all sport premises, including indoor and outdoor venues, fitness centers, beauty parlors and massage parlors, places of public entertainment, including performing venues, theme parks, museum, public exhibitions, cinemas, and family entertainment centers, and so on. And places of public entertainment, bowling alleys and public skating rinks, amusement game centers. And B, to extend the opening hours of catering premises till 10 p.m. and allowed a maximum 4 persons per table. Of course, such relaxation measures hinges on 2 prerequisites. First, from now to the 7th day of Chinese New Year, there will not be any major changes to the COVID-19 situation. Second, the persons in charge shall continue to comply with the existing measures. For example, the restrictions on venue and capacity, mask wearing, taking temperature, and providing hand sanitizers, and maintaining social distancing. They must also comply with at least 2 more latest measures. For the 2 new measures, first, the operator of the premises must arrange all staff to get tested every 14 days. The staff are required to keep the negative testing result for the checking by law enforcement officers. The operators can arrange their first testing 7 days before they resume the evening trade or reopen their business. They should get tested within the 7th day of reopening their business or evening trade. In other words, for those who plan to reopen or restart the evening trade on the 18th of February, the operators and person in charge must arrange their staff to get tested for the first time between the 11th to the 25th of February and get tested every 14 days afterwards. The staff can get tested at community testing centers. For the first 3 months, we will provide free testing service for these employees at community testing center free of charge. The staff can also collect their sample specimen kit at post office, vending machine in MTR stations, as well as the H8 designated general outpatient clinic, as well as returning their samples to the designated collection points. The relevant policy bureau and the department shall monitor the situation in considering whether to continue to provide testing service for certain sectors. Second, all premise operators must request the customers entering the restaurant and the premises to use the Leave Home Safe app to record their whereabouts or register the personal particular of the customers in order to offer effective assistance to the Center for Health Prevention in carry out epidemiological investigation, as well as offering further protection for their staff and the safety and health for the customers.
In addition, other than these two requirements, some other sectors will see new requirements. For example, we would request restaurants that provide dining and other indoor venues to install better ventilation. And these would also be included in our list of anti-pandemic measures. So that would be another requirement. Well, as we are still targeting to achieve zero, and yet we haven't achieved it, we need to be very prudent and to ensure that we adopt measures in controlling the pandemic. We would request those that do not comply with our measures to suspend operations from 3 to 14 days for deep cleansing and to enhance their measures. As for those restaurants and eateries that do not comply with our measures, they would also be asked to cease dinner provision for 3 to 14 days. And the 599F penalty will continue to be applied. Therefore, owners or who are in breach of the 599F will also be subject to a penalty of $50,000 and imprisonment of 6 months. We're going to provide more details of these for the individual sectors later. If we do not see any huge changes in the pandemic numbers, then after Chinese New Year, we're also going to seek the approval of EXCO to relax our gathering ban from 2 to 4 people. And people will be able to enjoy meals at a table for 4. All public services would also resume to normal starting from February 18th, and the Secretary for Education has also announced resumption of face-to-face teaching. Now I'd like to talk about vaccines. The advisory panel on COVID-19 vaccines held a meeting today in deliberation of Sinovac, and the 2 professors have already given a press briefing earlier. The advisory panel believes that the data provided by Sinovac are positive, but the panel has requested further data to be provided by Sinovac. The panel believes that Sinovac is more beneficial in the prevention of COVID-19 than risk. Therefore, I am going to speed up the approval of the vaccine for emergency use. Overall speaking, the government will ensure the safety and efficacy of the vaccines and to comply with the Prevention and Control of Disease Use of Vaccines CAP 599K in our emergency approval before we arrange for vaccines to be taken by the public. In order to enhance public confidence, we will continue to make transparent all the scientific data and to provide the most updated information on vaccines so that the public can be informed with all the accurate information of vaccines. The fourth wave began from November last year, and we have seen in peak days cases over 100 per day. Now the numbers are gradually reducing. However, we cannot let our efforts go down the drain. Therefore, I once again appeal to members of the public not to let down your guard and to continue to practice social distancing and ensure personal hygiene during the Chinese New Year. Otherwise, based on past experiences, we see that there might be a resurge in cases after long holidays. I call upon everyone to stay at home, to reduce social gatherings, including family gatherings, and to enjoy a more peaceful and quiet Chinese New Year. And if there must be family gatherings, please ensure you wear a facial mask at all times and ensure not to take meals together. For those who do not feel well during the holidays, I advise you to seek medical help as soon as possible and not to wait till the holidays are over. And please do not gather with your friends and relatives when you are feeling unwell. During the holidays, our community testing centers will continue operations. And providing testing services for anyone who thinks they are of high risk. Members of the public can also pick up specimen bottles from 20 MTR stations and from 8 general outpatient clinics under the HA and then return the specimen bottles to designated venues. Lastly, I'd like to wish all of you a Happy New Year. Thank you.
Secretary for Home Affairs, Mr. Casper Choi. Good afternoon, friends of media. Over the past 6 weeks, the government has invoked CAP 599J in prevention and control of disease of compulsory testing for certain persons regulation. To limit it to those in the specific areas must stay in their premises and subject to compulsory testing. In these restricted areas, the law enforcement have ensured that everyone has taken to the test. Since the January 23rd till today, we have carried out a total of 26 declaration and enforcement operations covering many districts, including Yaochimong District, Eastern District, Kwun Yuen Long, Sam Shui Po, Kowloon City, Chun Mun, and Sha Tin. In these operations, over 25,000 people get tested in these specified areas. We found there are about 18 cases. Through the declaration and enforcement operations, the goal is to identify these asymptomatic carriers early in the community so as to cut off the transmission chain in the community and dispel the public fear in order to restore faith in the community. Well, actually, it will hurt their business if we label it an infected area. We hope to cut off this transmission chain as early as possible in order to make sure that everyone had complied with the requirements in the RTDs and get the compulsory testing. And many government departments, upon conclusion of the compulsory testing, we immediately embark on the enforcement operation. In these enforcement operations, we found over 230 persons failed to get tested. We've issued a compulsory testing orders for many of those, or fined them for $5,000. Our goal is not to penalize the public. By using this declaration, we can cut off the transmission chain in the community. This is not only for the residents and their family members, and the whole community can quickly minimize the risk. We appeal to the public for themselves and others. They should comply with the compulsory testing declaration requirements. The government will continue to step on enforcement down the road. If we find anyone in breaches of the declaration, we will pursue it rigorously. I understand these RTD operations, it might bring some slight inconvenience. However, to identify the transmission chains will help for the public understanding. I would say that most members of the public have been very cooperative in these operations. In the operations over the past 2 weeks, we have been continually enhancing some of the details in order to minimize the impact to the public. As you recall, in the joint operations, which took 2 days, we try to lift the lockdown as quick as we can, and we make improvements later. In a specific area, we further narrow the scope, and the time required has been greatly compressed. In a lot of areas, when we start the operation at around 7 or 8 in the evening, when I arrive at the scene, they start lining up. They usually complete the test within under 30 minutes and collect their wristband and collect some food stuff. When they wake up in the morning, as they receive the SMS knowing they are safe and the community ready to be reopened, then they can get to work as usual. The operations, I make a lot of visits with the Director of Home Affairs. I see a lot of the children and the elderly. When necessary, we arranged priority queuing for them. For those who are mobility impaired, we arrange door-to-door testing. In the restricted areas, there are some residential or elderly homes. We'll also arrange door-to-door testing for them. We notice there are some non-residents stuck in the restricted area, which brings some inconvenience. We will consider individual circumstances in exercising discretion. First, we have the information and we can get them tested. We also minimize the inconvenience for them. During the RTD operations, after the operation, we set up a hotline. We know that there are a lot of ethnic minorities in these restricted areas. Therefore, we provide a hotline dedicated for them. When making any inquiries, we not only provide face-to-face phone call, and we have all of our colleagues at the site to answer their questions or provide assistance. As I recall, in Jordan, if some of the shop owners need to feed their pets, we will arrange for them as well. As you notice, we have improving our logistics in terms of providing food for the residents. We provide simple food stuff, which include bread, cakes, cup noodles, different cans and corn kernels, soya milk, and sometimes soup packets. Besides this, we also provide masks, bleaches, detergents, and hand sanitizers to help the compulsory testing subjects to take home after they finish testing in fighting the epidemic. We'd also like to thank different government departments mobilizing over 12,000 civil servants involving 40 policy bureaus and departments. I would like to thank, besides the HAD and district offices, the Civil Service Bureau and the Security Bureau and other disciplinary forces had worked together to providing support in fighting the epidemic, which included the disciplinary forces and some civilian grades. Where necessary, we also try to recruit ethnic minority workers in our team. We hope to, especially in areas with a bigger EM population, hope that we can explain the procedure to them and provide assistance if they come across any difficulty. Once again, I would like to thank those government workers who took part in the operations, the government contractors, as well as those in this restriction area for their understanding and support, and also the assistance from Only Incorporated for the smooth conducting of this testing. And finally, like Professor Chan said, with the Chinese New Year approaching, we hope that the public can reduce social gathering. I'm glad that we see that the numbers have climbed down from the peak of 75 to now dropped to around 26 to 27, a drop of over 60%. As you can see that these operations are effective in controlling the numbers, and the number of untraceable cases is at quite a low level at around 7 per day. Finally, let's have sent a quiet and happy Chinese New Year, and I wish everyone good health.
Hi.
Dr. Trump, please. Good afternoon. Yesterday, we confirmed 17 cases. Case number 106952 to 10711. 9 female, 8 male. Ages range from 13 to 72. 5 cases are identified at temporary testing centers, and we have 20 preliminary cases as of now. Out of the 17 cases, 13 of them are linked to other cases, including 2 that are from On-Tai Estate on the rehabilitation center, and they're 10702 and 10708, and also 11 cases that are also linked with previous cases. And there are 4 cases that are untraceable right now. One lives in Wailei building in 05 unit. That person was a preliminary confirmed case yesterday. And one person lives in Yuen Long, Bat Hang, Shan Long Ok Chun. And also one in Tai Wo Oi Wo building. On February 7, we issued a compulsory testing notice there, and today 3 cases were confirmed. The other 2 are all on the 14th floor. Earlier, there was also a case on the 14th floor. That means there are 3 units that have been affected on the same floor. So in Oiwa building, there are 3 cases on 1 floor, all on the 14th floor. So we believe there is actually a horizontal transmission on the 14th floor due to possible environmental contamination. So we are going to conduct deep cleansing, and we have also taken environmental samples. Although an order was issued for compulsory testing, some people may still be in their incubation period, and therefore we suggest residents who also live on the 14th floor to evacuate. And we are right now explaining to those residents on what to do. The 4th untraceable case lives in Song Chan San Chun in Yuen Long. Songchen Sanchun in Yuen Long. For the linked cases, some of them live in buildings that have not undergone compulsory testing, and we now issue an order including Cam Ning House, Camphor Court in Ma On Shan, Hong Fai Building on Dundas Street, Block 6 of Jubilee Garden, Bamboo Mansions of Whampoa Garden, Chun Wan, Hoi Ha Mansion and Riviera Gardens, and Kwai Ching Wah Fong Industrial Center. So that last one is an industrial building, and the confirmed person works in the industrial building and stayed overnight in the common room downstairs. We believe there is a small outbreak there, and therefore everyone working in that office has been sent to quarantine for a previous case, and Wah Fong Industrial Center will now be put under the compulsory testing order as well. For Lok Yang Sanchun, previously we have asked those living above 19th floor to move out. We're now going to issue a second compulsory testing order, and in Wailei building we have taken 14 environmental samples, but they were all negative. That's all for my report today. Dr. Lau, please. Good afternoon. As of 9 a.m. this morning, the HA recorded 41 cases in the past 24 hours. 2 patients in public hospital passed away. The first one is 10578, an 87-year-old chronically ill male patient. He passed away at 6:54 p.m. at QE Hospital yesterday. Another person, 10238, an 88-year-old chronically ill female patient. She passed away in Kwong Wah Hospital today. This patient was sent to hospital on January 25th and then confirmed positive. She was sent to isolated ward, but then her situation aggravated and she passed away this morning at 8:05 a.m. As of today, 183 people have passed away in our public hospitals. As of 9 a.m. this morning, 46 patients have been discharged from hospital, and altogether 10,022 patients have recovered and been discharged from hospital. As of 9 a.m., 450 patients are still staying in our 24 public hospitals and AWE center, out of which 22 are in critical condition, 21 in serious condition, and the rest, 407 patients in stable condition. We have opened up 1,237 negative pressure beds, utilization rate of 53%, and 679 negative pressure wards, occupancy rate of 65%. Well, we now move on to Q&A. Please be brief and concise in your questions, and please identify your media organization before you ask your questions, and please limit your questions to 3 at a time. The lady wearing gray. Good afternoon. I'm from Now TV, Now News. Well, hear that so there's a possibility that our bans could be relaxed starting from February 18th. So do you have any objective standards on what is considered acceptable, and what kind of information will people need to use if they do not use Leave Home Safe, and where does the responsibility lie if the person does not register or use Leave Safe Home? Just now, the advisory panel suggested that they're asking for Sinovac to provide data on the efficacy of the second dose being given on the 14th or the 28th day. Do you think that the information is not detailed enough? Is it a waste of time that you have to hold such a long meeting today, yet have to wait 2 more weeks for the information to be submitted? Well, first of all, we are positive with the situation based on the current trend. If everyone works together during the long holidays and continue to practice social distancing, we are confident that we'll be able to resume part of the measures as mentioned. So that's our view right now. Of course, we have to observe whether there is a huge rebound in cases or any major changes in the situation. Secondly, in relation to Leave Home Safe Cap under Cap 599F, many venues, including restaurants, will need to install Leave Home Safe app to be scanned by patrons. We now request customers, before they enter the premises, scan the Leave Home Safe app to record their whereabouts. Well, some people may say they do not have smartphones. We believe that there's only a very small number of people who do not use smartphones. When we discuss this with the sector, we believe that we will ask that person to leave some basic information, because we want to be able to trace that person in case there is a confirmed case. So it's most important that we'll be able to trace the customer. We are just trying to ensure everyone's safety by imposing this measure. Our two experts on the advisory panel has given us information on the vaccine. Sinovac has provided us with very positive data. The advisory panel just hope to have more details, and they will hold another meeting after they receive the new data. Or after we will consider the advice given by the advisory panel and then decision on whether this would be approved for emergency use.
Next question. Let me have the Director of Health explain to you. The Department of Health has been liaising with Sinovac. Are you referring to Leave Home Safe app? Speak another mic. Speak another mic. As for what kind of information customer need to provide, some simple particulars which can locate these customers. For example, telephone numbers, that's the name. Well, we won't locate them if there's nothing, if there's anything, and yet we don't have the information because the customer did not use the Leave Home Safe app. We will retrieve such information. If the person in charge failed to fulfill this obligation, that the PIC should be held liable. Next question. On your third row, the lady in the white jacket. HK01. On the restriction testing declaration operations, how to gauge effectiveness, do you see this as very ineffective as you managed to identify low teen case number in cases? It's just really just a show? The pandemic has been going on for over a year, with over 200 persons passed away and could not see to live to see the next Chinese New Year. Would the government consider apologizing to their family members? A question on relaxing the social distancing measures. Will there be any criteria? Do you have any indicators to see or you would suspend the relaxation? First, on the restriction testing declaration operations, and I'll talk about the overall effectiveness, and Secretary Choi can chip in if he like. Compulsory testing, it not just limited to the RTDs. In my opening remarks, I mentioned altogether we have tested over 380 buildings, in which we've issued compulsory testing notes for them. All along, we have identified plenty of transmission chains. Most recently, we need to conduct a thorough screening. We have also performed 26 restriction and testing declaration operations, which identified around 20 cases and 60 of their close contact. And please remember, we put the close contact under quarantine, and some of them are still under quarantine. We don't know if these quarantine persons will carry any confirmed cases among them. And looking at the overall positive rate at around 0.08%, this is not a low percentage. As the cases subsided, we need to step out our effort to detect these transmission chain or silent carriers. Every case matters in this case, so that we can offer early isolation and put them or quarantine their close contacts, so that in different districts or those high-risk buildings, give the public a peace of mind. From the public health perspective, let us know, or maybe on the environmental factors for some building with past cases, we want to know what's going on with them. This data is effective in controlling the epidemic and informing of our future strategy. And for those who passed away due to COVID-19, we are saddened by their passing. We'll do our utmost to curb the pandemic. I believe that the hospital authority, when treating and saving these patients, has been putting in their maximum effort. A third question on the relaxation on the restrictions on catering premises and certain scheduled premises. Like I said, if the pandemic continues to stay in this shape, or the case number further subsiding, as we said, on the 7th day of CNY, we will relax the measures on 2 types of premises. Of course, we shall keep the pandemic in view for any major outbreaks or sudden changes. We would definitely monitor the situation. Allow me to supplement. If you notice, from the 23rd of January onwards, the peak is around 24th. On that day, there was around 100 cases. I heard from the experts that how do we compress the testing required to get a quick snapshot of the area. And for this compulsory testing, they last for a few days for these asymptomatic cases, and yet it will take a few days to detect them, and while they're exposed to other people, the transmission risk will be enormous. Over the past 2 weeks, we will implement the RDD operations as a lockdown, simply put. Within the shortest possible time, we can confirm the risk level at the area. In some areas, when they yet to report any cases, within the shortest possible time, we can quickly ascertain any confirmed cases there. For example, in Quarry Bay Whaley building, we quickly identified 3 cases, and we found 7 of the close contacts. We immediately checked them away. The risk in the area can be minimized within a very short time. In other areas, from the past 2 weeks, there were some clusters or outbreaks or some environmental contaminations, or the sewage surveillance turned out positive. But we don't act quickly in trying to detect any potential risk. It's a good thing if we couldn't find any cases. And in the past 13 days, like Professor Chan said, we managed to identify 20 such cases. 1 case is too many in this restricted area. Well, 1 could spread to 3 and further multiply. Besides identifying such cases, actually by finding no cases, we're simply assuring the public. From 24th onwards, on its peak, or 2 weeks into the operations, the daily number of cases had dropped substantially by 65%, currently at around 20s per day. The untraceable cases have sharply reduced as well. We are using a quick and certain way to cut off these transmission chains early. That is really the objective of this RDD operations.
3項
Next question, please. The report in blue. Good afternoon, Stan News. I'd like to ask Secretary Choi. Well, you said that 1 case is too many. You want to just reassure members of the public. I want to see whether there is any benchmark of failure in your lockdowns. What is considered as a failure in your lockdown? A second question is for Dr. Chuang. Well, as a representative from CHP, you said that only when you achieve 0 will the pandemic actually be controlled. So why did you change your standards right now? A third question is for Secretary Chan. Well, let's say I have a smartphone, yet I do not want to use Leave Home Safe app. Do I have the option to only register my personal information? And if I provide inaccurate information, where does the liability lie? On me or on the premises? Well, most of the lockdowns are successful. We have many operations. I actually do not want to take these actions because if there is no need for a lockdown, then it means that there is already a minimal risk in that area. So my simple answer is our objective for imposing the lockdowns is to try to cut off the community transmission chain as soon as possible on the advice of experts. I'm sorry, the speaker is not coming through. Speaker not coming through. Our policy goal is to cut off the transmission chain as soon as possible. We have seen a huge decrease in the number of cases from before, so I do not understand why you seem to think this a failure. Speaker not coming through. Speaker is not coming through. I'm not saying that this is the only indicator. people have complied with our many anti-pandemic measures, such as practicing social distancing. Well, when people try to politicize our measures, then this is a nuisance to the public, and this is not something we want to see in this situation. I think our only enemy right now is the virus. Dr. Chuang? Well, I agree that we can be a bit more positive right now. I'm optimistic, but we have to be prudent and not to let the number of cases resurge. Secretary Chen, well, your question is related to Leave Home Safe app. I'd like to also talk about our policies. Other than imposing lockdowns, starting from last year, we have lowered the threshold for compulsory testing for many buildings. We have completed compulsory testing for over 300 buildings, and also issued 26 restriction testing declarations. Do not forget that we have also compulsory testing for certain persons, and some people have also gone for voluntary testing. From mid-November, there have already been 3.9 million tests completed. Of course, we have to thank the public for their support and for working with us. In relation to Leave Home Safe app, the question you asked could be possible. Of course, we do not want the public to deliberately give inaccurate information. It's not actually beneficial to the person providing the inaccurate information, because the Leave Home Safe app is to help identify confirmed cases that were present when you were at those premises. So when there is a notification of confirmed case, then that person could seek medical help or to be extra cautious. Therefore, providing accurate information is much beneficial. I'm sorry, we have to leave time for other questions. I think your questions have already been answered. Well, if I use a smartphone, must I use the Leave Home Safe app, and whose responsibility it is if the information provided is inaccurate? I have already said that the person responsible at the premises must request customers to scan the code, and the responsibility lies there. Let's answer an English question.
From RTX English News, questions to Health Secretary. About compulsory using the Leave Home Safe app for diners, there are privacy concerns raised from the public to use the app. How can you persuade the public to follow such rule? And how frequent law enforcement bodies will be checking on that? Will restaurant owners be prosecuted if diners violate such rule? And the second question is, under what condition the social distancing measure will not be relaxed? Is there concrete criteria to fulfill? For example, like only when how many days with single digits COVID cases will be relaxed continue? And a question to Dr. Chuang. Can you tell us more about the residential block in Taiwan? How were the flats where COVID patients live distributed? And how likely they are infected through sharing public spaces? Is there a need to evacuate residents in that block? And how would Dr. Chuang comment on the risk of having a sharp rise after the festive holiday? Thank you.
Professor Chen first.
Okay,
So for the Leave Home Safe app, under the current CAP 599 legislation, in fact, all the premises under CAP 599F would have to put in place the Leave Home Safe app for people to not to download, but in fact to swipe the QR code. We have now added. We intend to add the requirement, an additional requirement for the premises owners or the premises management to ensure when people enter the premise that they would have to swipe the QR code with their downloaded Leave Home Safe app. As far as enforcement is concerned, of course, the relevant license provider bureau would be responsible for the enforcement, plus all the authorized officers, and we will of course check the compliance of the Leave Home Safe app and also do enforcement appropriately. As far as the relaxation, the social distancing measures relaxation, as I've said earlier, now it seems that the epidemic situation is coming down slowly. Now, of course, if there is, if we follow this trend and there is no major outbreak, our intention is to open the premises that I have earlier announced, plus also the catering business with 4 people per table, and also they can have dine-in until 10 p.m. In the evening. So with the cooperation and also with the continuing trend, the going down and slowing, although slow, but going downhill trend of the epidemic situation, then after the Chinese New Year holidays, we would be able to reopen these premises and also the catering business relaxation. Okay, so you mean the Leave Home Safe app? Yes. So the responsibility or the onus is on the restaurant owner and also the premises owner or management to ensure that people would do that QR code when they enter the premise. Dr. Tran, please.
For the Oi Wo Lau in the estate, we first issued a compulsory testing notice on the 7th of February due to 2 cases confirmed in 1 unit in 14th floor of that building. And after we also confirmed 3 more cases today, and 2 of them stay in the same floor of the previous cases. So the whole floor has 28 units, and the first unit affected is in a relatively large number, and the 2 units today confirmed they are from the small numbers. They located about quite close to each other in opposite units. So it is possible they, when the first unit, the patients from the first unit, during the infectious period, they may use some common facilities such as the lift, maybe the mailbox, and also in the corridor. So it is possible that some environmental contamination happened, or they may just bump into each other during some occasions, although they don't know each other. So it is possible that other residents in the same floor are also incubating the disease, although a compulsory testing order has been issued, and I think most of them have been tested. So to be prudent, we put all the other residents into quarantine camp.
最後兩條。
Last 2 questions.
You could not a mic.
On whether we can comply with the infection control advice and all, wearing masks and wash your hands and also keep social distancing. Yeah.
最後兩條。
Last two questions. On your third row, the lady in gray.
So earlier, there was a delay in approving the Sinovac vaccines by the advisory panel. So will that affect the city's overall vaccine scheme and the pandemic control, and how? Thank you.
Professor Chen, please.
Okay.
張醫生，
As far as the Sinovac vaccine is concerned, I'm sure just now you have already heard from the members of the expert panel that the data provided is positive, but at the same time they would like to see more data in order to make their final decision. So I think once we receive their recommendation, of course, we as the Food and Health Bureau will try our best, to review and also to endorse the vaccine for emergency use. But we have to wait for the panel to review, further data.
最後一條。
Last question. On your third row, the gem in light blue. Commercial radio. Well, for the dozens or so lockdowns after Chinese New Year, when will you resume these operations? When resuming the testing operations, what will be the criteria? That's the first question. Second question for Oiwa House. Can Dr. Chung tell us for the entire floor, for the first case, when was the date? And among the infected units, which are the units affected? Do you see any connection with earlier confirmed cases? Is it possible? What would be the possible source of transmission? Our third question on Leave Home Safe app. Just now it was mentioned there are a lot of possibilities for this app. And if for any problems with the information, they'll be suspended for 3 to 14 days. So when would the business be suspended for 3 days or 14 days? Have we decided on the criteria or the penalty levels? For the restriction and testing declarations, we'll conduct a risk assessment and also compare the overall situation, the hygiene level of the buildings and other factors, and also the sewage surveillance as a complementary tool, whether it is negative or positive. These are the criteria that we should apply to see if we need to carry any further RTD operations. From now and throughout the Chinese New Year holidays, our compulsory testing notice, like I said earlier, if is one confirmed case, whether traceable or linked cases, we will issue a compulsory testing notice. Leave Home Safe app. First, we must know that it's really for our own good. With this app, we know that, well, if for a indoor venue in particular, this will carry certain risk. If anyone visited this place is confirmed, it will be good for their own safety and health. Well, for customers or anyone require them to scan the QR code, that will be the responsibility of the person in charge. And finally, a question on Oiwa House. Dr. Trung, the unit in Oiwa House had 2 cases. The date of confirmation was the date announcement. That's the 7th of February. The first case started having a fever on the 3rd of February and saw a private doctor and tested positive on the samples provided. The 2 other units, those confirmed today, on the 4th and the 7th, they start feeling unwell respectively, and they submit their sample on the 8th of February due to compulsory testing notice. The first case and the 2 other cases all live on the 14th floor, and there is a new case today on a separate floor that may not be related. There are 3 units. That building is divided into 3 groups. For the first case is in the middle, but closer to the bigger numbers. The 2 other cases are in the smaller ledges facing each other. And time-wise, they could be related. Maybe they had shared lifts or come across each other in the corridor without knowing, as they don't know each other, or may use some common facilities and use the mailbox or been in the lobby, which may lead to transmission. Even if the residents got all tested negative, there may be still some in incubation. Therefore, we've sent all of them to quarantine center for observation. That's the end of today's press briefing. Thank you for coming.
Well, I believe that we are going to request premise owners or responsible persons of premises to ask their customers to scan the QR code. There will be many details which will be provided later. Thank you.